Hello, everyone. My name is Christian Summers, and I'm a graduating biology pre-med major from Dallas, Texas. And today I'm going to be talking about cancer disparities. And one of the main cancer disparities I'm talking about is throat cancer. So, what are cancer disparities? So, cancer health disparities are extreme differences between certain population groups and cancer measures. These measures can include, but are not limited to screening rates, quality of life after treatment, cancer treatment, burden of cancer/related health conditions, stage of diagnosis, treatment received from healthcare professionals all across the world, and then people who are from low socioeconomic backgrounds often bear a greater burden of disease than the general population. So what are determinants of health? So determinants of health are the range of behavioral, biological, socioeconomic, and environmental factors that influence the health status of individuals or populations. So there are four different types of determinants of health, and the four types are social, economic, psychological, and physiology. So determinants of health can impact and determinants of health impact individuals can produce high pattern health differences in populations, resulting in social inequalities. So social determinants of health include income, education, race and ethnicity, transportation, housing and insurance, food access, and complex health needs. So one of the main social determinants of health that I thought was really important was income. Income plays a big role as a negative social determinant of health in many ways, but the main way it is because income such affordable issues can result in lack of funds needed to fill prescriptions for patients, which can be very significant. Limited access to healthy food, which can result in obesity and a bunch of heart diseases. Limited access to quality housing, which quality housing is essential into a healthy living lifestyle because without quality housing, you're going to be exposed to a lot of toxins in the air, mold that can really just get in your lungs and cause a bunch of just damage. So income plays a big role. Another social determinant of health is cancer health disparities. So social determinants of health are a major source of these inequalities in cancer and are primarily responsible for health inequities across the world. Research shows that the health disparities always affect non-white patients more negatively than white patients due to the patterns in their socioeconomic status. So basically, health disparities always affect minorities more negatively than Caucasian patients, which is very sad. So using social determinant frameworks and cancer health disparities. So these are ways social determinants can be beneficial to communities and patients in need. So a call for higher cancer screening rates for families located in underserved communities. These higher cancer screening rates can help to identify potential stages of cancer for patients that are at stage one in order to reduce and eliminate this type of cancer instead of, patients waiting until they're at stage two or three before they really notice that something's wrong with them. And at that point, it's too late to, you know, get rid of the cancer. Also, can help to adopt public policy such as the Affordable Care Act that improves access to high quality care for all. Also, using determinants frameworks can encourage leaders in disadvantaged communities to work together to evaluate local needs and update existing systems to improve cancer health equity. And this will be really important to in low income communities because instead of just being stagnant, these social determinants will help these leaders work with these communities to get the job done. So to implement cancer screening rates and implement mobile bans that can help with vaccines, like vaccine rollouts, or also just, help clinics that can help low income families that, that that lack the transportation to go to these doctors to get treated in order to, just take care of their health in general. So the main type of cancer disparity I was going to talk about today was throat cancer. So what is throat cancer? It refers to the cancer that develops in your throat, pharynx, or your voice box, or larynx. Throat cancer most often begins in flat cells that line the inside of your throat. A person's voice box sits below one's throat and is very susceptible to throat cancer. So as you can see in this picture on the left, these are symptoms of throat cancer. So which is a neck lump, it just sits on the neck, it's swollen, inflamed, and also a sore throat, which is very red. So if a doctor looks at your throat and it's very red, that can also be a symptom of throat cancer. So right here, laryngeal cancer is the common type of head and neck cancer, and according to cancer.net, it's estimated that 3,770 deaths from this disease will occur this year. So here are the different types of throat cancer. We got 5 different types. We got nasopharyngeal cancer, oropharyngeal cancer, hypopharyngeal cancer, glottic cancer, supraglottic cancer, and subglottic cancer. So the main types of cancer, throat cancer that are prevalent in today's society is nasopharyngeal cancer and glottic cancer, which we get with the vocal cords. So here's some images of throat cancer. So on the left, we got a normal mouth, and on the right side of the mouth, we got a throat cancer mouth. So as you can see, throat redness is very rare compared to this side. We got whiter spots on this side compared to no white spots on this soft palate. Swollen tonsil. You see how this tonsil is just, regular, normal. So these are just very some symptoms. And then also sore throat, whiter spots, which is a very common sign of throat cancer, and then a lump. So some signs and symptoms of throat cancer that are very prevalent in patients are a cough. It could be a dry cough, or it could be a mucus cough, but it's just a cough that's just ongoing, and it's just, you think it's gonna go away, but it just always comes back. Changes in a person's voice, such as hoarseness or not speaking clearly, difficulty swallowing, ear pain, a sore throat that is ongoing and it just doesn't leave. It's very annoying, a lump or sore that doesn't heal, and weight loss. So who does throat cancer primarily affect? Like what's the demographic that primarily affects? So people over the age of 55 are at the greatest risk of developing this type of throat cancer, but typically throat cancer affects more older men than women, especially tobacco users and alcohol users. These are the main people that have the greatest type of risk, but it typically affects more men because men typically tend to smoke tobacco more than women. But younger people are not as safe as well. Younger people who contract the HPV infection are also at risk. And also, of course, older men and women who located in low socioeconomic communities are at one of the greatest risks just because they have the lack of access to, get screened for this type of cancer, and just lack of access of just health facilities in general in their area. So what are the throat cancer treatment options? So a person's treatment options are based on many factors, and these factors include location and stage of the throat cancer and the type of cells involved. So treatment can include radiation therapy, surgery, chemotherapy, targeted drug therapy, immunotherapy. Chemotherapy and surgery are typically the two most common types of cancer treatment options, but all of these treatments depend on the stage of the cancer and just how a patient's feeling. Like, do they want to get surgery, or would they rather chemotherapy? So it just depends on the patient's feel, and also the doctor, and what do they truly think will be the best diagnosis or treatment option to get rid of this type of cancer. Well, hope you all have a great rest of the day. Hope y'all were informed about the what cancer disparities means and how they affect the community, and also what social determinants of health are and how they affect individuals as well. And also hope everyone was just, gain some more information and knowledge on throat cancer, and what it does and how it can affect the body, and just who it primarily affects and how it relates to cancer disparities as a whole. Hope you all have a great day.